From the moment you realize your child is struggling with a substance use disorder, the hard work begins. You may be thinking, I know my kid needs help, but how do I figure out what treatment option is best? The short answer, rely on licensed medical, mental health, or addiction treatment professionals. Your child is unique and their pathway to recovery might look different from someone else's. Your child's pediatrician or an addiction specialist can provide recommendations and appropriate options for your child's treatment. It's important that you have a basic understanding of the treatment options that may be recommended. In individual and group therapy, your child will explore personal issues with a trained professional in a private, secure setting. This can happen in a one-on-one or in a small group format. In an intensive outpatient program, or IOP, your child will visit and participate with a treatment provider for at least 3 hours a day, at least 3 times per week. A partial hospitalization program, or PHP, slightly more intense than an IOP. 3 to 7 days a week, your child will spend all day at the treatment center and return home at night. Partial hospital programs are focused primarily on psychiatric illnesses, though many individuals receiving this level of care also are treated for a substance use disorder. A residential or rehab program takes place in a lived-in treatment center under the supervision of trained staff who are available around the clock for therapeutic support. If this is the option recommended for your child, there's an entire module in this course dedicated to guiding you through the rehab experience. A medications for addiction treatment program is also called MAT. These programs were formerly known as medication-assisted treatment. MAT involves providing medications that help a person maintain sobriety. This is sometimes provided with additional counseling and/or with other behavioral therapy. The goal of MAT is to help regulate the brain and the body's normal functions without the negative physical and behavioral effects of the substance use disorder. The doctor or treatment professional may also recommend that you start exploring self-help options like support groups and 12-step programs. I know this is a lot of information to process, and you may be thinking, how do I choose the best plan for my child's recovery? The good news is that while you may feel like you have to make that decision yourself, we strongly recommend seeking the guidance of an expert. Make sure you feel confident that the chosen treatment option will set your child up for the best chance at successful recovery. Once you decide to seek treatment for your child, it's helpful to understand that the process will take time. A long, slow recovery is the goal, one small victory at a time. Lapses and relapses are often part of the recovery process. Why? Because lasting change in behavior usually involves a substantial commitment of time and effort. You may need to readjust and reassess treatment plans as you move forward. Now, all that said, if your child is no longer a minor, unless they provide consent, you won't have access to information about their care. In that case, do your best to keep lines of communication open and encourage them to complete their treatment. Throughout your child's treatment, be observant, be attentive, ask questions, and be patient with the process. This will lead to the best outcomes. At this moment, you may feel anxious, as if the clock is ticking down, while you have 1,000 decisions to make about your child's care. Remind yourself that getting the right treatment is a major step towards recovery. It's a decision you want to make from an informed perspective based on guidance from a substance use disorder specialist. You are not alone in this process.